Good afternoon, everybody. Welcome to our ATLAS Provider Roundtable for April. I know people are still joining, so we will give folks another 1 minute or so, and then we'll go ahead and get started. Thank you. All right, again, welcome everybody to our April ATLAS Provider Roundtable. My name is Angad Buttar, and welcome to everybody, and thank you for joining. I do have 2:01, so we'll go ahead and get started out of respect for everyone's time. So can we have the next slide, please? So our agenda for today will cover several topics. First, we'll talk about 2021 progress, objectives, and our timeline. And within our timeline and key dates, we'll talk about data collection and upcoming roundtables, also our CQI learning series. We also have several updates regarding ATLAS. So first, our public comment period summary. We'll talk about our professional portals and our claims measures planning grant. We also have key tips for completing the treatment facility survey. And then we'll close by discussing upcoming activities, and we'll have time for a question and answer as well. So as we get into new state updates, as everyone is aware, we are in 6 states currently. So Delaware, Louisiana, Massachusetts, New York, North Carolina, and West Virginia. And we will have an announcement in May on 4 new states that will be included in ATLAS. So we're excited about that. Next slide, please. So wanted to talk about progress thus far. So as everyone is aware, we have data in ATLAS right now for our 6 states. That is comprised over 1,200 facilities with treatment facility survey data in ATLAS. So that's roughly 49% of facilities across all of our 6 initial states. We also have 9,857 patient experience survey responses as of April 20th. And below you can see the breakdown per state. And we'll begin focusing more on the patient experience survey responses as we move into the next several weeks and month or so. We also have 350 plus participants across 4 continuous quality improvement learning series. And there'll be more information on our CQI learning series in the next few slides as well. So in addition to progress thus far, we've had over 98,000 website sessions nationwide since launch. And below on the table here, you can see a breakdown of how those fare across our 6 initial states. So of the 98,000, we've had 60,781 across our 6 states. And you can see the rough percentage next to that number as well. On the right-hand column, you can see the relative population out of the 6 states and what that percentage is also. Next slide. So in terms of increasing public awareness of ATLAS, we've had several big wins, and I'll quickly go through them here. So first, we've had ATLAS is in the process of being integrated as a key component of a county warm line in one of our states. We've had ATLAS added to the helpline website and helpline staff that have been trained on ATLAS in 2 states, and we have more in progress. We've also had a state Supreme Court integrate ATLAS into their state database for judges and court officers to really leverage as a referral source for treatment. We've also had multiple commercial payers across all of our ATLAS states that have added ATLAS as a referral source for provider-facing resource pages. And then we also have a op-ed penned by a state lieutenant governor on ATLAS that will be released fairly soon. Next slide. So in terms of our 2021 timeline, across May and July, we're going to be talking about data collection. And you'll see more about that in the subsequent slides. But that will begin on May 5th. So we're excited about that. Across August and October, we will conduct data analysis and validation. And we'll also have our provider preview period as well. Then in November, we will launch an updated ATLAS site for Delaware, Massachusetts, New York, and West Virginia. And I mentioned the provider roundtable earlier. So obviously we have our session today for April, but we're excited to have sessions scheduled for May, June, and July. So please mark your calendars if you can. And also we'll be sending invites before those dates as well. And as you'll see, for between August and October, we don't have the events scheduled currently. In November, we might have a possible event to launch the updated and refreshed site. So I mentioned earlier the continuous quality improvement learning series. So if you attended these sessions last fall, you'll have a little bit of context. If not, I can give you some additional detail here. So these events are held to help providers with tools that are needed to use and leverage the ATLAS data for improvement in their own facilities. The series also includes regular webinars, but this year we're happy to announce that we'll have some on-demand modules as well on the key quality improvement topics that we developed based on the national principles of care. And as always, we always welcome addiction treatment providers, state partner agencies, and commercial payers to join in the discussion. We found last year that the perspectives of our key stakeholders really helps not only have a more robust conversation, but it's helpful as it sort of answers questions that folks might have as well. And then lastly, all sessions are always recorded and will be shared after the event, and there's no cost to our attendees. And the upcoming CQI Learning Series schedule is below. So we have our first session on May 20th at 1 p.m. Our second session is already scheduled for June 24th at 1 p.m. And then, as I mentioned, we'll plan on releasing a pre-recorded session in July. And then the schedule for August and September is still to be determined, and we'll let you know as soon as those dates are finalized. So at this point, I will turn it over to my colleague, Carolyn Davidson. Carolyn?
Great, thank you so much, Angad. Great to be here. Happy to see a lot of familiar names. Also, I'll note that if you have any questions, please feel free to put them in the chat. As Angad mentioned, we will be having Q&A at the end, and also our colleague Terry Long is monitoring the chat, so she will reply to any kind of straightforward questions. As many of you know, we held a public comment period earlier this year to get feedback on both the ATLAS treatment facility survey and the data collection processes. We had over 30 responses from across our states, and there were some key themes that really emerged in these responses. First was a recommendation for Shatterproof to include opportunities to capture changes to facilities. And so we certainly heard the request to update facility survey data more frequently than annually. I will say that this is something that we're exploring, and we hope to have some announcements on this front in the coming months. We also heard that providers wanted opportunities to provide specific updates such as COVID-19 changes, and these have been incorporated into the treatment facility survey. I'll talk a little bit more about that. In addition, the ability to kind of respond to recent changes in treatment delivery due to COVID-19, such as including mobile or telehealth services, and reconsider the importance of listing the number of staff at each location, especially given telehealth capabilities. We also heard recommendations on updating the treatment facility survey questions, including simplifying and improving the accuracy of insurance plan listings, as well as adding first responders and people with intellectual disabilities to special groups served. We also heard the recommendation to reduce administrative burden on providers by enabling faster review of responses by attesting individuals, as well as allowing the entry of the same response for multiple sites for select answers where appropriate. We heard calls to enhance the patient experience data, so including a question in the patient experience survey about which level of care a patient received, adding more patient-reported outcomes measures, and adding a question to gauge whether a facility has a patient family advisory council. And lastly, we heard recommendations around changes on how level of care and services available are displayed, So a recommendation to clarify definitions of level of care for consumers, as well as the option to select offered at a different location available to all levels of care. And so based on this feedback, we have incorporated many of the recommendations in current changes. And so based on that, the following changes will be made to the treatment facility survey and data collection process. For those who submitted the treatment facility survey previously, the 2021 survey will be pre-populated with 2020 responses. And just with a note that this will be as many responses as possible will be pre-populated given some structural changes to the survey. So for those of you who submitted data last year, many of your responses, the vast majority of your responses will be pre-populated. Prior to final attestation, the respondent can now download a PDF of survey responses to share with leadership for review. In addition, the structure, format, and content of several survey questions was updated based on both the public comment period and one-on-one provider testing in order to improve the understanding of these questions and also the user experience. And so this includes the facility hours question as well as the full-time employment question. We've embedded additional validation checks into the survey to improve the consistency of responses and data quality. We also added several new survey items to capture additional information, really to track trends, but also what providers are experiencing. And so these new questions include many different areas, but some of them are questions about telehealth offerings, questions around patient-centered care, facilities assessment of patient social determinants, as well as COVID-19 impacts on facility operations. We've also created an improved email process, including improved email content and and format, as well as multiple facility survey links in a single email. So if you are a contact across multiple sites, instead of seeing 5 different emails for the 5 different sites, you will see a single email with details on each of your sites. And we're also in the process of working on a method for parent organizations with a large number of facilities to easily respond to the survey. And lastly, we are updating the help desk at ATLAS at Shatterproof. Providers who contact the help desk will now be responding to a form that will triage their requests more rapidly so that we can answer your questions much more efficiently. I'll note that while this data collection is underway, we are also working on a claims planning process. And so, as you know, we collected claims last year for ATLAS from both public and private payers. We are now in the process of kind of understanding how we can improve and streamline that process for calculating claims-based measures for 2022 and beyond, and also how we can improve the display of claims-based measures on ATLAS to really support consumer use of this data. So I'll note that something that we found in phase 1 of ATLAS or last year was that while a lot of providers found the claims measures very useful, that consumers or patients really weren't sure what to do with that information. And so some of our work will be in understanding what sort of displays are useful. So as I mentioned, this process is underway and it will end in December 2021. This process will include focus groups and testing of the measure displays. It'll include 4 stakeholder convenings to discuss the claims measure calculation, as well as developing a claims roadmap. So that will include recommendations based on the focus groups and stakeholder convenings and considerations for implementing those recommendations in 2022 and beyond. In addition to changes to the treatment facility survey and data collection processes, we will be making several enhancements to the ATLAS public-facing website. So first, just to note that when we are making website enhancements, it is via a data-driven approach. In developing the initial website, we completed multiple rounds of usability testing, specifically examining kind of the key parts of the website, the facility profile, search results, and homepage. We also held focus groups with consumers in 2 states, so this was in addition to our usability testing, as well as collected additional feedback from consumers, providers, states, and payers on the ATLAS displays. And so in 2021, we'll be making several enhancements to the website. First will be an improved display of insurance information so that patients will find it easier to navigate the insurance and recognize the plan that they may have. We'll be translating the entire website into Spanish with more languages on the horizon. We will be integrating state resources into the platform. So as Angad mentioned, we're in the process of working with several different helplines, but we'll also be integrating state helplines as well as social service platforms into ATLAS. In the near future, we'll be adding the ability to search for individual facilities by name. And we'll also be adding updated educational content and rewriting some of our existing content to increase accessibility. And I'll note that we will also be enhancing our password protected portals. So for those of you who submitted data, you have access to a password protected portal on the ATLAS website. Currently, that portal is primarily composed of a data table. We've certainly heard the feedback that that's not particularly useful. And so moving forward, we'll be doing a large revamp of the password protected portals in order to make them much more useful and easy to navigate for people. We'll be leveraging Power BI for dynamic visualizations, including maps, graphs, maps, charts, heat maps, and more. We'll also allow the ability to filter the data displayed by individual facility, by state, and other stratifications. The ability to compare the individual facility to other groups' performance more easily, and improving the downloadable data files to increase utility. And so you'll see here a de-identified screenshot of an example facility profile. So at the top, you have very basic information, what sort of patient survey rating are you seeing? How many of the principles of care do you meet? What percentile are you in for those principles of care, as well as the percentile for patient surveys? And then seeing a more state level view. And the data collection is opening soon. As Angad mentioned, that will be beginning on Wednesday, May 5th. And so we ask that you save that date. Don't worry, you'll get several emails in advance letting you know how to participate. Also, we are currently underway with the contact verification process. So the primary contact for your facility should have received an email requesting updates to your basic facility information. So just address, name, and that primary contact. And if you have any questions about this, don't hesitate to reach out to us. In terms of some key tips for completing the treatment facility survey, we recommend that you assign one staff member as an ATLAS champion, and this can be within your individual facility, or it can be at the parent organization level. This person will be responsible for ensuring all the data is gathered and submitted before the survey deadline. At specific facilities, it's sometimes really useful to have this individual be somebody really deeply familiar with facility services. We recommend that you circulate a reference copy of the treatment facility survey among relevant staff. So if you are a multi-site organization and you'll be having each of your different facilities submit their own survey, we recommend that you circulate a reference copy of this survey to make sure that they understand what questions they'll be answering. You can also, for instance, if you're a multi-site organization, fill out the questions that will be identical by facility in this reference copy and then send it to your facility teams. We recommend that you plan time in the calendar to complete the survey. The average time to complete it ranges from 30 minutes to 2.5 hours, with a median of about an hour. We recommend you schedule time with the appropriate leadership individual to secure their sign-off. As we noted before, you can now download your survey responses as a PDF so that you don't need them to go through every single page, and rather they can review this one document and then click through the final appropriate question when ready. And finally, we recommend that you review data carefully before submitting. If you need to make any changes after submitting the survey, you must contact us at ATLAS at Shatterproof during the data collection period. So we won't be having any post hoc data changes. And With that, I will send it back to you before we wrap up for Q&A.
Thanks, Carolyn. So I'd like to cover some next steps briefly. So first, as Carolyn just mentioned, please participate in the contact verification process by Friday, April 23rd. The primary contact at each facility should have received an email requesting updates to the facility information. And as you can imagine, this is greatly helpful to ensure that we have the right person in our database. Add provider roundtable dates to your calendar. The monthly roundtable events will include a Q&A session and relevant updates on ATLAS through July. The dates were earlier in the presentation, and we'll send this out to all the attendees as well. Please participate in the data collection process by completing the treatment facility survey. As Carolyn mentioned, we'll be opening this on Wednesday, May 5th. And primary contacts will receive an email with a link, and data collection runs through Friday, July 30th. And last but not least, sign up for CQI events and learn how to leverage the ATLAS data available in the professional portal. And please keep an eye out for updates that'll be coming to the portals this fall. And so please check out treatmentatlas.org to learn more about ATLAS and the platform if you haven't already. If you have any questions related to contact verification or for anything else, please don't hesitate to email us at atlas@shatterproof.org. And if there are questions that you have specific to your state, please see the individuals listed under each state. So for Delaware, Massachusetts, and West Virginia, it's myself. For North Carolina, it's Carolyn Davidson. And for Louisiana and New York, it's my colleague, Leah Kaufman. So at this point, we'd like to open it up for some questions and answers. And I did see a couple of questions come through the chat, so maybe we can go ahead and start there. So I know Jeff Savoy asked, do the patient surveys ask about preferences related to a program's permissive or restrictive policies on tobacco use? If surveys do explore these preferences, what did we learn? Carolyn, can I kick that off to you?
Absolutely, certainly. And so I'll note that we don't ask about reactions. And Jeff, if you're out there, please feel free to give a wave. I'll give you the opportunity to unmute yourself. Oh, hi, Jeff. Wonderful. So we don't ask about patients' responses to facility permissiveness or lack thereof towards tobacco policy. We do ask for facilities, do you allow tobacco anywhere? Do you allow it in certain areas? Is tobacco not allowed whatsoever? The questions that we ask to patients, I'm happy to send out as part of the follow-up. They're a detailed set of CAPS echo questions that ask really about the processes in the facility. So, to what extent were you asked if you would like your family to be involved in your treatment process? How frequently were you able to see a facility staff member as soon as you needed to? To what extent do you feel better able to, or better equipped to deal with your daily problems now than you did before beginning treatment? So it doesn't ask for instance, about any of those sort of facility kind of like quality of life details, I'd almost call them. Like, it doesn't ask about did you like the food? Did you like the beds? Were you upset that you couldn't smoke? Patients could add those things in the open field, but the majority of the other questions are really just focused on, what was their experience in these defined areas? Thanks. And Angad, I'll turn it back to you. And I know, Jeff, you had a few more questions. So Angad, I can jump in on Jeff's next question if you'd like.
Sure, absolutely.
Sure. So Jeff writes, New York State requires providers to maintain program profiles in a public database called PPSI, and perhaps other states do as well. Has ATLAS explored unidirectional data transfer from the state's program profiles to the ATLAS provider surveys? And to the point that there's a lot of data replicated. And thank you for that point about how long it takes you to complete the survey. We're hoping that with this updated format and with the pre-population that it will be slightly faster. I'll note that in both New York and Massachusetts, we are working with our state partners who already have that sort of database that you're referring to, and we are pre-populating certain information based on that database. So in New York, that includes, if you want, that can include contact information, facility address, phone number, as well as levels of care for the facility. And the same is true in Massachusetts. And we'll actually be working in New York, we'll be working with our state partner to really create a message that you'll see indicating where you should submit those data. So for instance, if there are certain data that you need to update in ATLAS, we might direct you to the PPSI or to the provider data directory system to update the data there. And so that way you don't have to enter it in two places. We'll be pulling from certain data with our partners.
Yeah, I would just encourage you to do file transfer or data transfer with as many data elements as translate, and then give programs the opportunity to overwrite if they want. But you know, if there's 25 data elements that look like they would transfer and you're only using 15, please pick up the other 10.
Duly noted, Jeff. Thank you. And that's something that we're certainly exploring, is how we can do a more detailed kind of data linkage on the back end.
Good, thank you.
Thanks for that question, Jeff. We have another question in the chat from Sarah Bennett, and Sarah asks, if the primary contact changed and we have not received the email, who should we reach out to? Sarah, you can either reach out to the atlas@shatterproof.org email address, or based on your state, if we have the list of the names listed for each state, feel free to reach out to that individual as well. But we do want to make sure that we update the primary contact, and then also make sure that you do get the contact verification email as well.
And you're welcome, Sarah. And I'll just make a quick note that this year, in addition to improving the email process, we have also gained the ability to include multiple people on those emails. So for instance, if you want your clinical director and your program director to receive the data collection email, you now have that option available to you. And so you'll see that in the contact verification form. As long as it said, if you haven't received the contact verification form and would like to either check on or update who the contact is for your facility or facilities, please contact us at atlas@shatterproof.org. And while people are still thinking, thank you, Terry, for putting the email in the chat. I'll note that we actually, Jeff, to your question about smoking, I'll note that my colleague, Shannon Biologist, let me know that we have started to do some qualitative coding of the narrative responses to the patient feedback. And so we hope to have those results soon. Certainly smoking apparently was something that came up a lot in our narrative feedback. And so once we have those results ready, we will certainly share with you.
I think it's also important to share those with your state partners once you understand patients' perception of permitting versus prohibiting tobacco use. Especially in New York State, we would love you to share those with OASS.
We certainly will. Yes, I appreciate that comment.
Very
Definitely
good.
will.
Are there any other questions from the group? Feel free to put them in the chat. Yep, Amanda asked, will these slides be sent out? Yes, they will. We'll make sure to send them out in follow-up. Any other questions? And please don't be shy.
This is Chris Perdmore. I think it's easier just to state my question, if that's okay.
Please, of course.
Okay. I'm actually a Shatterproof ambassador, as well as on the recovery side of things here now in marketing for FLACRA, and we're in New York State. One of the observations I have, obviously there's some challenges on our end as perceived, but as I've come in the organization, I've realized that they don't really know who Shatterproof is and what we represent on a whole. And I'm wondering what is being done to represent the anti-stigma messaging along with this? Because I think one of the challenges we have about implementation is it looks like it's just a database for a lot of people rather than the total organization and what it represents. I think there might be some value in that, at least to get more buy-in. We have some unique challenges and why there's been some issues, but I'm working on that on this side. So I guess my question is, what is being done to explain what ATLAS is, what Shatterproof is beyond just ATLAS?
Yeah, that's a good question, Chris. Thanks for bringing that up. I will say in some conversations that we're having with, as it relates to promoting ATLAS, we try to also see if there's an opportunity to talk about some of the more other initiatives that Shatterproof has. You mentioned stigma. There's some other campaigns that we have as well. So we really are trying to sort of educate a lot of our stakeholders, existing states and also some of our new states. The stigma campaign has been out in a few states as well. And so internally within Shatterproof, we've been sort of making sure that we have kind of an integrated message with our stakeholders as well. So I think more to come on that, but I think we're realizing that we do want to sort of branch off, from just sort of a singular ATLAS message and help folks understand, the value beyond ATLAS and looking at Shatterproof more broadly as well.
I think its greatest impact is because the people that are actually doing the surveys may have very little visibility to what Shatterproof even is, and this is just one more checklist. So it may help.
No, that's a great point, Chris. That's a great point. And I think to your point, I'll just add one more thing. In terms of, ATLAS being, just a database, I think one thing that we're trying to do, a bit more, this year is with our, CQI learning series, right, provide some of those technical assistance resources as well, based on, some of the ATLAS data. And I think we're also, as Carolyn walked everyone through sort of the updated portal screens, I think hopefully that will be a bit more user-friendly so folks can really get more value out of that data, right? You guys are doing the hard work of, providing, the surveys. And I think, we're excited about the sort of added capability and functionality of the portals as well. So hopefully that will lend itself to more of a value add for folks as well.
And I'll say that I really appreciate that point, Chris, and certainly and also congrats on the FLACRA position. I know I've seen our paths have crossed a bit before. So, and I'll note that we certainly have the opportunity, and I'm thinking about it in a lot of the emails that we send out, there is the opportunity for us to say, as an FYI, here's what else Shatterproof is working on, if that's of interest.
Thank you.
Well, thank you, Chris. I see a few other questions that came through in the chat. Let's see. So the verification process must be done by 4/23. Yes, we are sort of endeavoring to get all of that completed by the 23rd. Oh, Terry, I just got a response. Thank you.
And I'll note that that's just the contact verification. That's just making sure that we have the correct contact on file. I will note that this isn't a drop dead deadline. If you decide that you need to change the contact on 4/24, you can certainly reach out to us. No worries. It's more that we want to really update as many facility contacts as we can prior to data collection start. But again, there's no hard deadline on that. Even after data collection starts, you can still update your contacts.
Thanks for that clarification, Carolyn. I saw another question come through the chat. Can you elaborate on what you consider a session with regard to internet traffic? Thanks for that question, Jeremy. So essentially, when we say a session, if someone navigates to treatmentatlas.org, that will sort of count as a session. Now, if that person then goes back to Atlas the next day, the data that we're showing is only showing that sort of singular site visit from that, I guess, unique like IP address or computer. So if I, on my laptop right now, went to treatmentatlas.org 5 times, we'd count that as one session, even though there have been sort of 5 visits. I hope that's helpful. Thanks for that question, Jeremy.
And I can just quickly add, you did such a good job explaining it. Yeah, and so it's basically if there's, I think it's a half hour of inactivity is sort of the kind of the defining line. So if Anga goes on the website on Treatment Atlas, he explores it for a while. He clicks a bunch of pages. That would still all be one session. He leaves and comes back, say 40 minutes later, that would be a new session.
Next question, do you track length of time on your site and click through other pages and pages? Yes, we do. We do track that in some of our details or analytics that we have. Are there any other questions? You feel free to unmute yourself if you do, or if you'd like to put it in the chat, feel free. Excuse me. Well, if there are no additional questions, I know I want to be cognizant of folks' time, so feel free to log off. We'll stay on the line for another minute or two in case any last minute questions come in. Thank you all for your time today, and I hope you have a great rest of your day. Take care.